we're still having alpha fights in an Omicron world. Omicron is very, very different. The disease is much more transmissible, much more contagious. So basically, if you look at the studies, alpha was 2 times more contagious than the wild. Delta was 2 times more contagious than alpha, and Omicron is 2 to 4 times more contagious than Delta. And as humans, we're not really good at processing exponential growth. But what we do know, there was a study done in Japan about Delta that basically we were shedding with Delta 1,000 times more virus than Alpha. That's an enormous change, right? Now, and that made it 2 times more contagious. So we're looking at 2 to 4 times more contagious with Omicron. Now we're talking about exponential, millions of times more virus that we're shedding with Omicron than with others, which makes it just, again, so explosive and super contagious and makes it much more harder to contain. It also moves through us much more quickly. So instead of taking 6 days from contact to actually getting symptoms, now we're talking 2 days. So by the time people are getting tested, they've already infected a whole bunch of people who have already infected a whole bunch of people. And our ability to contact trace with numbers like this is just virtually impossible. And so that changes the value of testing.
So there's 2 main changes that we're talking about today, and these are temporary changes, but I think things that are really important to affect our public health actions here in Utah. So the first change we're doing today is that we're recommending people who have symptoms, they really should stay home, act as if they have COVID, and not necessarily need to go get testing. The second change is that we're putting tests on hold under advisement with Governor Cox, Speaker Wilson, and President Adams. And then last, I do want to mention that we are reaching out to groups that are holding events or businesses that have requirements that people test in order to come to their event or to work. Right now, the Utah Department of Health, in fact, the entire system doesn't really have the capacity to do those mass testings and mass screenings. And so we are asking those organizations to reevaluate what they're doing in terms of their approach to prevent infection. We recognize it's really useful to test people to make sure you don't have spread in your event, but right now that's very difficult.
And so we do have sources for remote instruction to prepare our students and be able to respond in a very nimble manner to the pandemic. It's not something we want to do in a permanent way, of course, but we do have tools available to put out into our homes and to be able to interact with their teachers during these very brief periods of remote learning. We believe that by giving schools and staff a chance to pause and reset, as one school district put it, we can slow the transmission and we'll be able to get our students back to their classrooms for higher quality education in a safe and healthy environment. Thank you.
Government, as we all know, doesn't get to decide how pandemics behave and how they spread across our state and across the world. And we're trying to be as nimble as possible in order to address the current needs of the state of Utah. And trust me, none of us want to be here talking about COVID or viruses or masks or tests ever again, but it is the time we still need to be doing that. So the legislature starts next Tuesday. And as we get to doing the people's work, we aren't really sure how Omicron is going to affect our ability to conduct the legislative session. But you should know that we are absolutely committed to doing the work of the people of the state of Utah. And we also recognize that we may have to make some adjustments along the way as we navigate this. Like the governor, I'm hopeful that this virus is about to peak here in the state of Utah and that we see a decline in cases shortly. And I just would reiterate what's also been said, which is ask each of us to do our part to make sure that we're helping with that.